As we've already seen, it is really important to understand that in a persistent pain situation, pain rarely equals damage. Understanding this helps to explain why there is not always an identifiable reason for your ongoing pain. Yet we appreciate that your pain is still very real for you on a daily basis. Most people with persistent pain would say that one of the most frustrating aspects of their situation is the fluctuating pain levels they experience. Bad days that come along for no obvious reason, no clear activity that has caused you to be in a lot more distress than you were before. Even with analysing your previous few days, you can't see why is it that I'm having such a bad day today. We're going to now look at one particular factor which can influence the levels of pain that you experience, and that is of emotion. Good emotions can cause your pain to decrease, but negative emotions can cause your pain to increase. As you can see on the diagram in front of you, when you're feeling a negative emotion, such as anxiety, it causes chemicals to be released in your body which have the effect of increasing the sensitivity of your pain system. The consequence of this increased pain system sensitivity is that you then experience increased pain levels. And as you would undoubtedly agree, when your pain levels are going up, or you might call it a flare-up, it causes a great deal of stress and anxiety. This ends up being a vicious cycle which just gets worse and worse and worse. Here's another way to illustrate the point. If we take this vase full of water to represent your pain levels that you're experiencing, you can see at the moment that the water level is 5 out of 10. So that might be an average day for you, experiencing 5 out of 10 in pain. If we take these two balls to represent negative emotion, so maybe fear, maybe anxiety, something's going on in your life which is causing you to become anxious, maybe there's even a fear of movement or a big event that's coming up that you're concerned about. When we put these into the mix, so you're feeling fear and you're feeling anxiety, you can see that naturally the water level rises. And this is what happens with your pain. You were experiencing 5 out of 10 pain, just a normal day. Then there's some fear or anxiety or other negative emotions come in, and your pain level will naturally rise up to about an 8 out of 10. And that's without you having done anything different. That's without any more damage or wear and tear occurring within your body. But the effect of the negative emotions is to cause your pain level to rise from 5 out of 10 to 8 out of 10. Effectively, a bad day has occurred, and that can be an explanation of what's going on there. But actually, this isn't all bad news, because whilst this explains a flare-up or a bad day, actually the reverse is also true. If you look at the slide in front of you, we can see on this diagram that as the anxiety decreases, if you're able to take steps to decrease the fear or the anxiety that you're experiencing, that will result in decreased sensitivity of the pain system. And this in turn then lowers the pain levels that are experienced, or actually you might want to call it this flare-up begins to settle down. So if we go back over to our vase of water, so in our vase of water we have 8 out of 10 pain, a flare-up day, and there's fear and anxiety going on. When we remove the ball, so we remove the fear and the anxiety, you've been able to deal with those things that have been causing you distress, we can see that the pain levels naturally settle back down to a 5 out of 10, back to your normal resting level. And that's without any cure. We've not done anything to treat the pain. We've just removed the negative emotions which has caused your pain levels to settle down to a normal level and effectively recover from the flare-up and all the bad day that you've been experiencing. I appreciate this doesn't mean your pain is cured, but it certainly makes it more manageable. It has been shown through many studies and anecdotally that persistent pain sufferers do experience more fear, anxiety and low mood than other patients. This is often just a natural consequence of the persistent pain that you have to live with. We're not saying that negative emotions cause pain in the first place, but they actually can affect the amount of pain that you will experience. So if we just recap the main points from this talk. Increases in persistent pain rarely means that harm or damage has occurred. All types of emotion will have an effect on the pain that you experience. Some of these emotions can increase the pain levels, but others, more positive emotions, can decrease the pain levels. And by recognizing this and understanding this, We know that this can help you to manage your pain better and to recover from flare-ups quicker, and hopefully even maybe to avoid flare-ups in the first place.